Question 36. After a dynamic air removal cycle concludes, an SP technician begins unloading the hot sterilization cart. To maintain the absolute integrity of the sterile barriers, which specific physical handling technique must the technician employ when transferring the heavy wrapped instrument sets to the cooling racks? A. Dragging the sets across the metal cart surface to minimize lower back lifting strain. B. Physically lifting each heavy tray cleanly off the surface without sliding it vertically or horizontally. C. Immediately pressing the exterior packaging to manually verify the internal chemical indicators have changed color. D. Stacking the freshly processed trays closely on top of one another to expedite the rapid ambient cooling phase. Correct answer, B. Knowledge point explanation. Core rationale. Aseptic presentation requires that sterilization wrappers remain completely intact without microscopic punctures or abrasions. When moving wrapped trays, the technician must physically lift the item clean off the wire rack because any dragging or sliding motion will cause friction, instantly tearing the delicate synthetic barrier and contaminating the entire surgical set. Trap analysis. Option A. Dragging causes friction that slices through the sterilization wrapper. This would be the correct answer if the technician was pushing a massive, wheeled, sealed rigid containment transport cart across a flat concrete hallway. Option C. Touching or squeezing hot, freshly processed packs forces warm air out and draws cool, contaminated room air and moisture directly into the package. This would be the correct answer if the technician was pressing down on the latch mechanism of a cooled rigid container to verify the tamper-evident seal was locked. Option D. Stacking heavy wrapped trays crushes the sterile barrier and creates massive condensation pockets that prevent proper cooling. This would be the correct answer if the technician was safely stacking flat, lightweight, empty plastic wash basins inside the decontamination sink. Concept extension. Proper body mechanics must be utilized when cleanly lifting heavy orthopedic sets, ensuring the technician's spine remains straight while utilizing the leg muscles to elevate the 30-pound instrument trays. Question 37. A technician is preparing to process a delicate, heat-sensitive polymer catheter utilizing a 100% ethylene oxide sterilizer. To determine the precise amount of time this specific item must remain inside the heated aeration cabinet to safely off-gas the toxic residues, which authoritative document must the technician exclusively consult? A. The preventive maintenance manual provided by the ethylene oxide sterilization machine manufacturer. B. The specific written instructions for use published directly by the polymer catheters manufacturer. C. The Universal Toxicity Exposure Guidelines published on the Federal Environmental Agency's website. D. The chemical safety data sheet included alongside the sealed gas cartridge shipment. Correct answer, B. Knowledge point explanation. Core rationale. Ethylene oxide gas is absorbed deeply into plastic and polymer materials during the lethal exposure phase. The only legally binding and scientifically validated source that dictates exactly how many hours a specific medical device must be aerated to become safe for human contact is the original equipment manufacturer's instructions for use. Trap analysis. Option A. The sterilizer's manual dictates the operational capabilities of the chamber, not the required physiological aeration time for individual surgical items. This would be the correct answer if the technician needed to know the exact sequence for replacing the machine's internal air filtration cartridge. Option C. Federal guidelines establish maximum atmospheric exposure limits for the workers, not the outgassing parameters for the polymer instruments. This would be the correct answer if the technician was researching the permissible exposure limit for ambient ethylene oxide vapor in the restricted breathing zone. Option D. The safety data sheet provides emergency spill procedures and chemical composition data for the raw sterilant, not processing instructions for medical devices. This would be the correct answer if the technician accidentally dropped and ruptured a gas cartridge and needed immediate evacuation and neutralization protocols. Concept extension. Removing an item from the aeration cabinet prematurely puts both the handling technician and the patient at severe risk for chemical burns, hemolysis, and systemic carcinogenic exposure. Question 38. While sorting a mixed bin of surgical instruments at the brightly lit preparation workstation, a technician needs to physically isolate the highly durable tissue scissors that feature specialized welded jaw inserts. What specific visual cue on the instrument allows the technician to rapidly identify the presence of these hardened tungsten carbide cutting edges? A. The finger rings are plated with a highly distinctive gold finish. B. The entire shank is coated with a specialized glare-resistant black polymer. C. The distal tips feature a deeply etched silver identification groove. D. The cutting blades are painted with a highly visible orange indicator dye. Correct answer, A. Knowledge point explanation. Core rationale. Surgical instruments are color-coded by manufacturers to denote specialized material properties. Tungsten carbide is an exceptionally hard metal welded onto the jaws to create a sharper, longer-lasting cutting edge. The universal industry standard is to plate the finger rings of these specific instruments with a gold finish for instant visual identification. Trap analysis. Option B. Black handles designate a completely different type of cutting mechanism known as a supercut or microserrated scissor. This would be the correct answer if the technician was searching for a specialized scissor that features one razor-sharp knife edge and one microserrated lower blade designed to prevent tissue slippage. Option C. Standard surgical-grade stainless steel does not utilize etched silver grooves to denote material hardness. This would be the correct answer if the facility utilized a proprietary mechanical etching system to permanently track which specific instrument tray the scissor belonged to. Option D. Paint is strictly prohibited on the distal working ends of surgical instruments as it would flake off directly into the patient's wound. This would be the correct answer if the technician was identifying the specific color-coded latex-free material used strictly to test the sharpness of laparoscopic scissors during the inspection phase. Concept extension. When testing the sharpness of a gold-handled tungsten carbide tissue scissor, the technician must utilize the standardized red testing material to accurately evaluate the integrity of the hardened blades. Question 39. While aggressively brushing dried, crusted blood from a skeletal curette at the decontamination sink, a technician realizes the operating room staff failed to perform the required point-of-use treatment. To prevent this hardened bioburden, at what precise moment should the surgical team have initiated the gross soil removal process? A. Instantly following the conclusion of the surgical procedure before the organic debris can dry. B. Exactly 1 hour after the instruments are successfully transferred to the decontamination area. C. Immediately prior to the surgeon making the initial incision on the patient. D. During the most critical and active phase of the intraoperative surgical intervention. Correct answer, A. Knowledge point explanation. Core rationale. The primary defense against biofilm formation and pitting corrosion is the immediate application of moisture and enzymatic foam at the point of use. If blood is allowed to dry, it turns into a cement-like substance that severely impedes the sterile processing workflow. Therefore, gross soil removal must happen immediately after the procedure ends in the operating room. Trap analysis. Option B. Waiting an hour allows massive amounts of impenetrable biofilm to form, defeating the entire purpose of pre-treatment. This would be the correct answer if the technician was timing the required manual soaking duration for a heavily crusted orthopedic reamer immersed in a specialized enzymatic bath at the sink. Option C. Instruments are completely sterile and actively being organized by the scrub nurse prior to the incision. Treating them with cleaning chemicals at this point would contaminate the sterile field. This would be the correct answer if the question asked when the circulating nurse should perform the final surgical timeout verification. Option D. The surgical team cannot wipe down and spray instruments while actively handing them back and forth to control severe patient bleeding. This would be the correct answer if the question asked when the scrub nurse should be aggressively monitoring the sterile field for compromised barriers or dropped items. Concept extension. Point-of-use treatment is a critical infection control parameter that bridges the gap between the clinical setting and the decontamination zone. Failure to execute it properly directly leads to delayed processing times and damaged stainless steel surfaces. Question 40. While monitoring the biological indicator results from a recently completed 270° Fahrenheit steam sterilization cycle, an SP technician confirms that the lethal thermal energy successfully eradicated the highly resistant test spores. What is the smallest, most fundamental building block of these living microscopic entities that the technician has just destroyed? A. The microscopic cellular structure. B. The internal cytoplasmic fluid pool. C. The centralized genetic nucleus core. D. The macroscopic biological organ. Correct answer, A. Knowledge point explanation. Core rationale. To understand the mechanism of sterilization, technicians must grasp basic microbiology. The cell is universally defined as the absolute basic, fundamental unit of all living organisms. The pressurized steam physically penetrates this cellular wall and completely denatures the internal proteins, resulting in the death of the pathogen. Trap analysis. Option B. The cytoplasm is merely the internal jelly-like matrix contained within the cell, not the foundational unit of the organism itself. This would be the correct answer if the educator specifically asked to identify the fluid substance where cellular chemical reactions actively take place. Option C. The nucleus is a specialized organelle housed inside the cell structure, not the complete building block. This would be the correct answer if the technician was asked to identify the specific anatomical region of the microbe that houses its inheritable DNA sequences. Option D. An organ is a massive, highly complex structure composed of millions of tissues, which are in turn composed of cells. This would be the correct answer if the technician was asked to identify what level of biological hierarchy the human liver represents. Concept extension. Steam sterilization specifically targets the cellular proteins of the microbe. The introduction of moisture significantly lowers the temperature required to coagulate and destroy these cellular building blocks compared to dry heat alone. Question 41. An SP technician is training a new hire in the decontamination area. The technician emphasizes the vital importance of constantly identifying which items are contaminated, which are clean, and which are sterile, while actively preventing them from mixing. What foundational concept does this specific workplace philosophy represent? A. The core principles of asepsis. B. The fundamental tenets of the bloodborne pathogen standard. C. The overarching goals of infection prevention. D. The baseline requirements for environmental control. Correct answer, A. Knowledge point explanation. Core rationale. Asepsis literally translates to being free from disease-causing contaminants. The principles of asepsis are the active, daily physical practices of maintaining strict situational awareness regarding the exact microbial status of an item, dirty, clean, or sterile, enforcing strict physical separation between these states, and immediately mitigating any accidental cross-contamination events in the processing environment. Trap analysis. Option B. This is wrong for this scenario because this standard focuses strictly on employee protection from blood, not the philosophical separation of inventory statuses. This would be the correct answer if the technician was explaining why the facility mandates the use of fluid-resistant gowns and heavy-duty gloves when brushing lumens. Option C. This is wrong for this scenario because infection prevention is the ultimate broad objective of the entire hospital, whereas asepsis is the specific, granular physical practice described here. This would be the correct answer if the technician was asked to define the ultimate, overarching objective of the entire sterile processing department's existence. Option D. This is wrong for this scenario because environmental control relates to HVAC systems and room parameters, not separating dirty and clean instruments. This would be the correct answer if the question asked what category the daily recording of the prep room thermostat falls under. Concept extension. Aseptic technique applies everywhere in the facility, dictating that a technician must never touch a sterilized tray after handling an unwashed transport cart without first performing rigorous hand hygiene. Question 42. an operating room nurse requests an immediate use steam sterilization cycle for a dropped bone rongeur. As the SP technician finalizes the documentation for this emergency load, what specific information must be recorded to justify bypassing the standard terminal sterilization workflow? A. The patient's identification details and the specific clinical rationale for the expedited cycle. B. The final interpretation of the biological indicator and the load testing parameters. C. The completed leak testing verification and the endoscope serial number. D. The process challenge device's lot number and the manufacturer's expiration date. Correct answer, A. Knowledge point explanation. Core rationale. Regulatory and surveying bodies intensely scrutinize immediate use steam sterilization because it poses a higher risk of contamination and should never be utilized for inventory convenience. To prove the cycle was a genuine clinical emergency, the legal logbook must explicitly link the cycle to a specific patient identifier and clearly state the exact reason, such as a dropped one-of-a-kind instrument, the rapid process was necessitated. Trap analysis. Option B. This is wrong for this scenario because immediate use items are rushed directly to the sterile field before the required biological incubation period is finished, meaning this data cannot be part of the initial release justification. This would be the correct answer if the question asked what data must be definitively confirmed before a standard terminal implant load can be released to the operating room supply core. Option C. This is wrong for this scenario because leak testing is a procedure specific to flexible endoscopes, not solid stainless steel surgical instruments undergoing steam sterilization. This would be the correct answer if the technician was asked what quality assurance data must be recorded before submerging a colonoscope in a high-level disinfectant basin. Option D. This is wrong for this scenario because while challenged device lots are recorded for standard loads, this data does not provide the clinical justification for running an emergency cycle. This would be the correct answer if the question asked what specific consumable data must be logged when running the daily sterilizer qualification test in an empty chamber. Concept extension. If a facility consistently lists lack of standard inventory as the rationale for emergency cycles, surveyors will cite the hospital for severely deficient supply chain purchasing and instrument management practices. Question 43. The Sterile Processing Manager is establishing a comprehensive new quality assurance initiative to reduce packaging errors. To ensure this program is truly effective and captures all necessary perspectives, who must actively participate in this continuous improvement process? A. Every sterile processing employee alongside a representative cross-section of their clinical customers. B. Only the executive hospital administrators and the infection control directors. C. The lead surgeons and the visiting vendor representatives. D. Only the certified technicians working directly in the inspection and assembly area. Correct answer, A. Knowledge point explanation. Core rationale. A true quality management program recognizes that quality is a collaborative, systemic effort, not a top-down mandate. It strictly requires the granular, hands-on input of every processing employee actually doing the physical work, combined with the vital end-user feedback from a cross-section of their internal customers, such as operating room nurses, who ultimately receive and utilize the trays. Trap analysis. Option B. This is wrong for this scenario because high-level administrators do not perform the daily physical workflow and cannot accurately identify specific mechanical assembly errors. This would be the correct answer if the question asked who holds the ultimate financial authority to allocate the annual budget to purchase a multi-chamber automated washer system. Option C. This is wrong for this scenario because surgeons and external vendors are isolated to the procedural end and do not observe or understand the internal mechanics of the processing department's workflow. This would be the correct answer if the question asked who should provide specific ergonomic feedback regarding the balance and feel of a newly trialed orthopedic bone saw during a live procedure. Option D. This is wrong for this scenario because quality is facility-wide. A dirty instrument originates in decontamination, so limiting the program only to the assembly technicians will fail to solve the root cause. This would be the correct answer if the question asked who is strictly responsible for interpreting the manufacturer guidelines and correctly inserting the internal chemical indicator into a rigid container. Concept extension. Effective programs utilize defect tracking databases to anonymously log errors, allowing the department to spot trends and apply targeted educational interventions rather than punishing individual technicians. Question 44. A nurse on the intensive care floor suddenly requires a specialty tracheostomy care tray that is not kept in their standard floor stock. The nurse fills out a specific electronic request form and sends it to the central sterile department to have the item delivered. What specific inventory replenishment method is being utilized in this scenario? A. The periodic automatic replenishment system. B. The on-demand requisition system. C. The vendor-managed supply chain network. D. The decentralized consignment inventory model. Correct answer, B. Knowledge point explanation. Core rationale. A requisition system is an on-demand inventory distribution method. It is utilized when a clinical unit requires a highly specific or infrequently used item that is not part of their daily baseline stock. The unit must initiate a formal request, a requisition, to explicitly ask the processing department to manually pick and deliver that precise item. Trap analysis. Option A. This is wrong for this scenario because an automatic replenishment system tops off standardized inventory to a preset level without requiring the nurse to manually ask for each item. This would be the correct answer if the question asked what system is used when an SP tech travels to the critical care unit every morning to autonomously refill their bandage bins back up to exactly 50 units. Option C. This is wrong for this scenario because vendor management involves external corporate representatives controlling the stock, not internal hospital requisition requests. This would be the correct answer if the question asked what system is utilized when a representative from a medical implant company personally arrives to restock the hospital's titanium screw shelves. Option D. This is wrong for this scenario because consignment refers to a financial ownership model, not a physical transport request method. This would be the correct answer if the question asked what financial model is used when a highly expensive biologic tissue graft sits on the hospital's shelf but is only financially charged to the facility after it is actually implanted in a patient. Concept extension. Requisition systems are highly financially efficient for expensive, specialized surgical trays, as they prevent capital from being unnecessarily tied up in static inventory sitting idle on every single patient floor. Question 45. A central sterile processing department has recently been tasked with reprocessing dental and podiatry instruments for 3 off-site outpatient clinics located across the city. To successfully manage this complex new logistical workflow, what are the 2 most critical operational elements the SP leadership must prioritize? A. Procuring only single-use disposable instruments for the external facilities. B. Developing a completely isolated and proprietary software tracking matrix. C. Establishing meticulous logistical planning and maintaining open communication channels. D. Deprioritizing the preventive maintenance schedules for the transport vehicles. Correct answer, C. Knowledge point explanation. Core rationale. Supporting affiliated off-site clinics introduces massive logistical hurdles involving traffic delays, biohazard containment during long transit times, and complex turnaround expectations. Success relies entirely on meticulous planning, defining exact transportation routes and handling procedures, combined with constant communication, coordinating urgent needs or missing items between 2 physically separated buildings. Trap analysis. Option A. This is wrong for this scenario because specialty clinics heavily utilize precise, reusable stainless steel instruments. Forcing a total shift to disposable tools is financially ruinous and clinically unacceptable to the surgeons. This would be the correct answer if the manager was asked for a drastic strategy to completely eliminate reprocessing needs in a remote, water-deprived military triage tent. Option B. This is wrong for this scenario because tracking systems must seamlessly integrate with the main hospital's existing matrix to ensure total inventory visibility, not be isolated. This would be the correct answer if a software developer was hired to build the digital infrastructure for a brand new, standalone ambulatory surgery center with no parent hospital affiliation. Option D. This is wrong for this scenario because transporting biohazards requires perfectly maintained vehicles. Ignoring maintenance leads to breakdowns and massive compliance violations. This would be the correct answer if the question asked what an irresponsible manager might do to save money in the short term, leading to eventual catastrophic delivery failures. Concept extension. Transporting contaminated instruments over public roads elevates the regulatory requirements. Vehicles must be strictly equipped with Department of Transportation compliant rigid, leak-proof, and heavily labeled biohazard containment vessels. Question 46. An SP technician in the preparation area is scanning the barcode of a newly purchased, highly complex cardiac pacemaker implant before organizing it for sterilization. They note the strict federal tracking requirements attached to this specific item. Under federal oversight, into which risk category is this life-sustaining device placed, necessitating the most rigorous pre-market approval process? A. Class 1 medical devices. B. Class 2 medical devices. C. Class 3 medical devices. D. Class 4 medical devices. Correct answer, C. Knowledge point explanation. Core rationale. The Federal Oversight Agency categorizes medical products based on the level of risk they pose to the public. Life-sustaining or life-supporting implants, such as heart valves and pacemakers, represent the highest potential risk to patients. Therefore, they are categorized as Class 3 devices, requiring manufacturers to submit extensive clinical data through a stringent pre-market approval application before they can be legally sold. Trap analysis. Option A. This is wrong for this scenario because it represents the lowest risk category subject to the least regulatory control. This would be the correct answer if the technician was cataloging basic, non-invasive supplies like manual toothbrushes, elastic bandages, or simple handheld retractors. Option B. This is wrong for this scenario because it represents moderate risk items requiring a different pre-market notification process. This would be the correct answer if the technician was verifying the FDA clearance status for a newly purchased biological incubator or a specific brand of sterilization indicator tape. Option D. This is wrong for this scenario because the federal classification system in the United States maxes out at 3 distinct tiers. This would be the correct answer if the question asked to identify a fictitious or non-existent federal regulatory device classification within the current United States framework. Concept extension. Facilities must maintain impeccable sterilization and tracking records for Class 3 devices, as any malfunction or processing error can lead to immediate patient mortality and mandatory federal recall investigations. Question 47. While manually decontaminating a heavy tray of specialized retractors used during a major abdominal resection, a technician recalls the anatomical function of the large, highly vascularized organ these retractors were holding back. Which specific organ actively filters metabolic waste, detoxifies harmful chemicals, and processes amino acids from the bloodstream? A. The biological kidney structure. B. The endocrine pancreas organ. C. The primary hepatic liver. D. The bile-storing gallbladder. Correct answer, C. Knowledge point explanation. Core rationale. Processing surgical instruments safely requires a foundational understanding of human anatomy to anticipate bioburden hazards. The liver is the body's massive primary filtration and metabolic center, responsible for scrubbing toxins from the blood, synthesizing proteins, and breaking down amino acids. Instruments used in hepatic surgery are often heavily saturated with thick, coagulated blood. Trap analysis. Option A. This is wrong for this scenario because it specifically filters urea and excess water to produce urine, not primarily process amino acids and detoxify systemic chemicals like the liver does. This would be the correct answer if the technician was processing a delicate stone basket used during a nephrectomy procedure. Option B. This is wrong for this scenario because its primary function is producing digestive enzymes and regulating blood sugar via insulin. This would be the correct answer if the technician was asked to identify the organ responsible for glycemic control while cleaning instruments from a Whipple procedure. Option D. This is wrong for this scenario because it merely acts as a storage reservoir for digestive fluids produced elsewhere. This would be the correct answer if the technician was aggressively flushing a laparoscopic suction irrigator tip that became clogged while removing concentrated bile during a cholecystectomy. Concept extension. Surgical tools used on highly vascular organs like the liver must be kept continually moist at the point of use to prevent the rapid hardening of blood within box locks and serrations. Question 48. An SP technician is physically removing a steaming hot, uncontained bone drill from an immediate-use steam sterilizer chamber adjacent to the operating room. Regarding the subsequent handling of this rapidly processed item, which specific action is strictly prohibited by aseptic processing guidelines? A. Transferring the item directly to the active sterile field for immediate surgical application. B. Transporting the item securely using an approved enclosed rigid containment vessel. C. Placing the process device onto a storage rack to be held for a procedure scheduled the following morning. D. Ensuring the item was thoroughly decontaminated according to the manufacturer's manual guidelines prior to the rapid cycle. Correct answer, C. Knowledge point explanation. Core rationale. The fundamental definition of an immediate use cycle is speed and instant application. Because the item is typically processed with minimal or no drying time and utilizing specialized rapid containment, it lacks the durable sterile barrier required for long-term environmental protection. Storing these items for later use completely violates established infection control protocols. Trap analysis. Option A. This is wrong for this scenario because directly utilizing the instrument is the exact intended purpose of this emergency processing modality. This would be the correct answer if the question asked to identify the primary clinical justification for bypassing the standard terminal cooling and quarantine phase. Option B. This is wrong for this scenario because moving the hot instrument within a validated rigid vessel prevents hallway contamination and is a highly recommended safety practice. This would be the correct answer if the question asked how a technician should physically carry a rapidly sterilized clamp across a busy substerile corridor to the scrub nurse. Option D. This is wrong for this scenario because meticulous manual cleaning is an absolute mandatory prerequisite before any sterilization cycle can occur. This would be the correct answer if the question asked to identify the most critical physical step that cannot be skipped, even during an extreme surgical emergency involving a dropped tool. Concept extension. Facilities are frequently audited to ensure their immediate use sterilization rates remain exceptionally low, proving the practice is reserved solely for unpredictable emergencies rather than routine inventory shortages. Question 49. A technician donning extended cuff nitrile gloves is preparing to manually immerse a flexible bronchoscope into a soaking basin located in an exhaust-ventilated room. To achieve the required microbial kill level for this semi-critical device, which specific combination of chemical agents is approved for this high-level disinfection process? A. Concentrated phenolic mixtures and quaternary ammonium compounds. B. Liquid glutaraldehyde and orthothialdehyde solutions. C. Diluted sodium hypochlorite and standard isopropyl alcohol. D. Ethylene oxide gas and hydrogen peroxide vapor. Correct answer, B. Knowledge point explanation. Core rationale. Semi-critical items like flexible endoscopes contact mucous membranes and must undergo high-level disinfection to destroy all vegetative bacteria, viruses, and fungi. Liquid glutaraldehyde and orthothialdehyde are the primary, FDA-cleared chemical formulations specifically designed and validated to safely and effectively achieve this high-level germicidal action on delicate optics and flexible lumens. Trap analysis. Option A. This is wrong for this scenario because these are strictly low-level and intermediate-level environmental disinfectants. This would be the correct answer if the technician was selecting a chemical wipe to decontaminate the stainless steel assembly tables and the external housing of a mechanical washer. Option C. This is wrong for this scenario because bleach is highly corrosive to delicate medical instruments and alcohol evaporates too rapidly to maintain extended wet contact time. This would be the correct answer if the technician was asked to identify chemicals commonly used to disinfect environmental blood spills or wipe down external patient stretchers. Option D. This is wrong for this scenario because these are gaseous sterilants processed in sealed mechanical chambers, not liquid solutions poured into manual soaking basins. This would be the correct answer if the technician was programming an automated low-temperature machine to completely sterilize a moisture-sensitive cardiac catheter. Concept extension. Before immersing the endoscope, the technician must physically verify the chemical potency of the high-level disinfectant by utilizing a specifically matching minimum effective concentration test strip. Question 50. An assembly technician is evaluating a fresh shipment of synthetic peel pouches to ensure they are free of manufacturing defects before inserting delicate hemostats. Because a failure of this sterile barrier presents a moderate risk to the patient by potentially allowing microbial ingress, how does the Federal Oversight Agency formally classify these specific packaging materials? A. Class 1 medical devices. B. Class 2 medical devices. C. Class 3 medical devices. D. Class 4 medical devices. Correct answer, B. Knowledge point explanation. Core rationale, sterilization packaging, including synthetic pouches, sterilization wraps, and rigid containers, must perform a critical function, maintaining the sterility of surgical tools until the point of use. The Federal Regulatory Agency considers a barrier failure a moderate risk to patient health. Therefore, all sterilization packaging systems are strictly classified and regulated as Class 2 medical devices, requiring manufacturer validation testing. Trap analysis. Option A. This is wrong for this scenario because this category is reserved for low-risk items that pose minimal harm if they fail. This would be the correct answer if the technician was managing the inventory levels for standard tongue depressors or non-sterile examination gloves. Option C. This is wrong for this scenario because this category is reserved exclusively for the highest risk, life-sustaining items. This would be the correct answer if the technician was documenting the serial numbers for a tray containing permanent artificial heart valves prior to sterilization. Option D. This is wrong for this scenario because the federal classification system operates on a 3-tier model, and this category does not officially exist. This would be the correct answer if the question asked to identify a fictitious regulatory classification tier often used as a distractor on certification exams. Concept extension. When selecting a Class 2 packaging pouch, the technician must ensure the material is chemically compatible with the chosen sterilization modality, as using a standard paper plastic pouch in a hydrogen peroxide machine will abort the cycle. Question 51. When a technician receives a sealed set of loaned bone rasps from an external vendor for a scheduled orthopedic surgery, what is the mandatory first step that must be performed before these items can be prepped for the sterile field? A. The devices must be subjected to a low-temperature sterilization process. B. The instruments must undergo a complete manual and mechanical decontamination process. C. The items must be visually inspected and decontaminated only if gross soil is present. D. The items must be immediately rejected and banned from use in the facility. Correct answer, B. Knowledge point explanation. Core rationale. Loaned instruments must be treated as contaminated upon arrival, regardless of how clean they look or what the vendor claims. They must go through the facility's complete decontamination, cleaning, and sterilization process per the manufacturer's instructions for use before they can be utilized in surgery. Trap analysis. Option A. This is wrong for this scenario because the sterilization method depends strictly on the manufacturer guidelines, not merely on the fact that the item is loaned. This would be the correct answer if the instructions for a specific heat-sensitive loaned endoscope explicitly mandated hydrogen peroxide gas plasma sterilization. Option C. This is wrong for this scenario because visual inspection is insufficient. Deadly microscopic biofilms are completely invisible to the naked eye. This would be the correct answer if a technician was deciding whether to spot clean a non-critical patient care item like a wheelchair that had a visible coffee spill on it. Option D. This is wrong for this scenario because loaned items are a standard and highly necessary logistical practice for specialized or infrequent surgical cases. This would be the correct answer if the loaned instruments arrive severely rusted, pitted, and fundamentally damaged beyond mechanical repair. Concept extension. Loaned instrument policies require vendors to provide exact written processing manuals for every item, and sufficient time must be allotted, often 48 hours prior to surgery, to complete the full reprocessing cycle. Question 52. During an annual performance review, an SP technician is praised for their ability to quickly adapt to sudden trauma add-on cases and for consistently maintaining a calm, professional demeanor under pressure. These specific personal attributes are highly valued components of which core competency? A. Advanced clinical communication skills. B. Mandatory legal and regulatory responsibilities. C. Essential employability and soft skills. D. Group-based teamwork mechanics. Correct answer, C. Knowledge point explanation. Core rationale, employability skills, often referred to as soft skills, represent the personal attributes that make an individual a highly valuable employee. Adaptability to changing workflows, unwavering reliability, ethical conduct, and strict professionalism go far beyond mere technical processing knowledge and are critical for success in the department. Trap analysis. Option A. This is wrong for this scenario because communication specifically governs the transmission of information through speaking or writing, not an internal emotional ability to adapt to schedule changes. This would be the correct answer if the technician was praised for clearly articulating a complex sterilizer failure issue to the operating room charge nurse over the phone. Option B. This is wrong for this scenario because a professional demeanor is an individual soft skill, not a legally mandated federal law. This would be the correct answer if the technician was praised for strictly maintaining patient confidentiality in accordance with the Federal Health Insurance Privacy Acts. Option D. This is wrong for this scenario because adapting to a schedule change and possessing a calm personal demeanor are individual traits, even if they ultimately benefit the whole shift. This would be the correct answer if the technician was praised for actively organizing a collaborative, synchronized effort among 3 staff members to rapidly assemble a massive spine set. Concept extension. Developing strong employability skills is absolutely crucial for career advancement in sterile processing, as leadership roles require intensely managing stressful situations, navigating interpersonal dynamics, and mitigating constant workflow changes. Question 53. A technician in the decontamination area attempts to power on an automated sequential compression device prior to wiping it down and notices the digital display screen is heavily cracked and unresponsive. Which specific hospital department must the technician notify to execute the necessary repairs? A. The Central Sterile Processing Department. B. The facility's surgical operating room staff. C. The Biomedical Engineering Department. D. The Infection Prevention and Control Committee. Correct answer, C. Knowledge point explanation. Core rationale. The Biomedical Engineering Department, also commonly known as clinical engineering, is specifically equipped and officially responsible for the technical maintenance, safety testing, preventive upkeep, and physical repair of all electronic patient care equipment within the healthcare facility. Trap analysis. Option A. This is wrong for this scenario because while sterile processing cleans and dispenses the equipment, they are not licensed or trained to perform complex electronic repairs on circuit boards. This would be the correct answer if a floor nurse found a patient care pump covered in dried bioburden and needed it to be picked up for immediate decontamination. Option B. This is wrong for this scenario because the operating room is merely the clinical end user of the equipment and does not possess repair capabilities. This would be the correct answer if the technician discovered that a specialized orthopedic power drill was missing from a delivered case cart and needed to inform the clinical users immediately before the incision. Option D. This is wrong for this scenario because infection control committees dictate cleaning policies and epidemiological tracking, not mechanical hardware repairs. This would be the correct answer if the technician needed high-level guidance on the proper disinfection protocol for a device exposed to a novel, highly contagious airborne pathogen. Concept extension. When broken equipment is identified, it must be immediately removed from service, thoroughly decontaminated so it is safe to handle, and physically tagged with a highly visible defective equipment label before being dispatched to biomedical engineering. Question 54. A technician is reviewing a surgical schedule and sees a procedure listed as a colostomy, prompting them to build a tray containing specific bowel retractors. In medical terminology, what structural role does the element ostomy play in this specific procedural word? A. It functions as a root word. B. It functions as a combining vowel. C. It functions as a prefix. D. It functions as a suffix. Correct answer, D. Knowledge point explanation. Core rationale. In the anatomy of medical terminology, a suffix is a word element placed precisely at the end of a root word to fundamentally alter or specify its meaning. The element ostomy is a suffix attached to the end of an anatomical root, like col for colon, to specifically indicate the surgical creation of a permanent artificial opening. Trap analysis. Option A. This is wrong for this scenario because the root provides the core anatomical subject, not the specific procedural action taken upon it. This would be the correct answer if the technician was asked to identify the structural role of gaster, meaning stomach, in the word gastrectomy. Option B. This is wrong for this scenario because a combining vowel is usually just the letter O used merely to connect word parts for smoother pronunciation. This would be the correct answer if the technician was asked to identify the structural role of the letter O in the word arthroscopy. Option C. This is wrong for this scenario because a prefix is positioned at the very beginning of a word to modify its parameters, such as location or time. This would be the correct answer if the technician was asked to identify the structural role of peri, meaning around, in the word perioperative. Concept extension. Distinguishing between similar-sounding suffixes is critical to building the correct tray. For example, ostomy means creating an opening, whereas tomy means simply cutting into, and ectomy means surgically removing entirely. Question 55. A technician is moving a basket of arthroscopic shavers through the department workflow. At what exact sequential stage must the technician sit at a lighted magnifying workstation to formally evaluate these devices for flawless functionality and hidden damage? A. Immediately after the items have completed the terminal sterilization cycle. B. During the initial sorting phase before any chemical detergents are applied. C. Right before the surgeon receives the items in the operating room. D. After the items have been thoroughly cleaned but prior to packaging. Correct answer, D. Knowledge point explanation. Core rationale. Formal inspection for cleanliness, moving part functionality, and microscopic damage is the paramount activity of the preparation and packaging area. This intensive evaluation can only be safely and accurately performed after the obscuring biohazard has been entirely removed during the decontamination wash, and strictly before the item is sealed inside its sterile barrier. Trap analysis. Option A. This is wrong for this scenario because inspecting an item after sterilization inherently requires breaching the protective wrapper, which instantly destroys the sterile barrier and ruins the item. This would be the correct answer if the technician was checking the external tamper-evident locks on a rigid container immediately after pulling it from the cooling rack. Option B. This is wrong for this scenario because instruments are highly hazardous and heavily coated in thick bioburden before cleaning, making microscopic functional inspection fundamentally unsafe and visually impossible. This would be the correct answer if the technician was identifying and separating single-use disposable sharps from reusable metal instruments at the sink. Option C. This is wrong for this scenario because while clinical staff do perform a brief point-of-use check, the formal, intensive magnification inspection process must happen entirely within the sterile processing department before sterilization. This would be the correct answer if the question asked when a scrub nurse should perform their final visual verification of a scalpel blade's structural integrity before handing it to the surgeon. Concept extension. The inspection phase is widely considered the ultimate quality control checkpoint of the entire sterile processing loop. A technician must never blindly assume the mechanical washer disinfector perfectly cleaned every crevice of every instrument. Question 56. A technician is organizing freshly sterilized, flat-wrapped instrument sets onto newly installed racks in the climate-controlled storage zone. To prevent mop splashes and dust from contaminating the inventory, what specific physical design must the lowest tier of this shelving unit possess? A. It must be constructed of a continuous, unperforated material and elevated exactly 8 to 10 inches above the floor level. B. It must be manufactured from an open metal grid and raised exactly 8 to 10 inches above the floor level. C. It must be constructed of a continuous, unperforated material and elevated precisely 2 to 4 inches from the floor surface. D. It must be manufactured from an open metal grid and raised precisely 2 to 4 inches from the floor surface. Correct answer, A. Knowledge point explanation. Core rationale. Sterile storage shelving requires strict physical parameters to protect sterile barriers. The bottom shelf must be solid to physically block contaminated water from splashing upward during routine floor mopping. It must also be elevated 8 to 10 inches off the ground to allow cleaning equipment to easily pass underneath without striking the packages. Trap analysis. Option B. This is wrong for this scenario because a wire grid allows contaminated floor water to splash directly upward through the gaps onto the sterile packages. This would be the correct answer if the technician was selecting the design for the top shelf of the storage unit where dust accumulation must be minimized. Option C. This is wrong for this scenario because 2 to 4 inches of clearance is far too low to accommodate standard facility floor mops and brooms. This would be the correct answer if the technician was describing a standard wooden pallet used strictly for temporary offloading in a non-medical warehouse receiving bay. Option D. This is wrong for this scenario because it fails both the height requirement and the solid barrier requirement. This would be the correct answer if the question asked to describe a commercial kitchen cooling rack designed to let air circulate around hot bakery pans resting near a counter. Concept extension. In addition to bottom shelf requirements, standard guidelines dictate that sterile packages must be stored at least 18 inches below the ceiling sprinkler heads to ensure unimpeded fire suppression water flow. Question 57. A technician is attempting to package a delicate, heat-sensitive neurosurgical drill cord utilizing standard medical-grade paper plastic peel pouches. Which specific low-temperature sterilization modality will immediately abort the cycle if the technician places this cellulose-based packaging inside the chamber? A. Saturated vapor delivered via a dynamic air removal process. B. Vaporized hydrogen peroxide infused with electromagnetic plasma. C. 100% concentration ethylene oxide alkylating gas. D. High-temperature vapor delivered via gravity displacement. Correct answer, B. Knowledge point explanation. Core rationale. Cellulose is a highly absorbent plant fiber found in all standard paper and cotton textiles. In a hydrogen peroxide sterilizer, the cellulose materials rapidly absorb the peroxide sterilant out of the atmosphere, causing the machine's sensors to detect a fatal drop in chemical concentration and forcing an automatic cycle cancellation. Trap analysis. Option A. This is wrong for this scenario because steam sterilization is fully compatible with cellulose paper pouches, as the steam easily permeates and releases from the paper without aborting the cycle. This would be the correct answer if the technician was successfully packaging a heavy stainless steel orthopedic set using a cellulose-based disposable wrapper. Option C. This is wrong for this scenario because ethylene oxide gas is completely compatible with cellulose packaging materials and will easily penetrate the paper matrix. This would be the correct answer if the technician was successfully packaging a heat-sensitive plastic urinary catheter using a standard medical-grade paper plastic peel pouch. Option D. This is wrong for this scenario because gravity displacement steam is highly effective with standard paper pouches. This would be the correct answer if the technician was safely packaging a single stainless steel hemostat in a paper plastic pouch for processing in a tabletop dental clinic autoclave. Concept extension. When processing items in a hydrogen peroxide gas plasma sterilizer, technicians must strictly utilize non-cellulose packaging, specifically spunbond polyolefin materials commonly known by the brand name Tyvek. Question 58. While inspecting a heavily soiled Fraser suction tube at the decontamination sink, a technician locates the thin, rigid wire component that accompanies the device. If the technician were to explain the primary clinical application of this wire to a trainee, what specific physical action does the surgical team perform with it? A. They manually insert the wire down the lumen to actively dislodge coagulated blood clots and tissue blockages during the active procedure. B. They utilize the wire to precisely measure the anatomical depth of the surgical incision prior to closing. C. They slide the wire into the channel specifically to hold the internal lumen completely open during the terminal sterilization cycle. D. They attach the wire to the proximal hub to act as an electrical grounding mechanism against stray cautery currents. Correct answer, A. Knowledge point explanation. Core rationale. A suction stylet is a specialized metal rod matched to the exact diameter of its corresponding suction cannula. During surgery, suction tips frequently become clogged with dense bone fragments or thick blood. The surgeon utilizes the rigid stylet to instantly plunge through the narrow lumen and physically push the obstructing bioburden out, restoring the suction vacuum. Trap analysis. Option B. This is wrong for this scenario because stylets do not feature calibrated measurement markings and are not depth gauges. This would be the correct answer if the technician was explaining the clinical application of a graduated uterine sound utilized to determine the depth of the cervical cavity. Option C. This is wrong for this scenario because leaving a solid wire inside the lumen during processing completely blocks the sterilant from making contact with the inner walls. This would be the correct answer if the technician was inserting a specialized, manufacturer-approved hollow steam venting tube into a complex robotic sheath to facilitate vapor penetration. Option D. This is wrong for this scenario because a stylet is a physical plunging tool, not an electrosurgical pathway. This would be the correct answer if the question asked to describe the function of a disposable dispersive pad adhered to the patient's thigh to safely return electrosurgical energy to the generator. Concept extension. During the inspection phase, the technician must ensure the stylet easily slides entirely through the suction tube. If it meets resistance, it indicates catastrophic internal damage or highly compacted retained soil. Question 59. An SP technician is urgently preparing a dropped cranial periosteal elevator for an immediate use steam cycle located in the substerile core. To ensure the undried instrument remains protected from environmental contaminants while being carried back to the surgical field, which specific enclosure must the technician load the elevator into? A. A standard spunbond polyolefin Tyvek peel pouch. B. A rigid metal or plastic containment box explicitly tested and approved by the manufacturer for rapid cycle processing. C. A traditional woven muslin textile wrapper folded in a sequential envelope technique. D. A dual-layer paper and plastic combination pouch designed for standard terminal steam. Correct answer, B. Knowledge point explanation. Core rationale. Immediate use steam sterilization skips the drying phase, leaving items wet. Standard wrappers and pouches rely on being completely dry to maintain a sterile barrier. If they are wet, they instantly wick bacteria inward. Therefore, immediate use items must be transported in specialized, rigid, sealed containers that have been rigorously validated by the manufacturer specifically for wet, rapid transport scenarios. Trap analysis. Option A. This is wrong for this scenario because Tyvek is a specialized plastic material engineered for low-temperature modalities and will easily melt or warp in a high-temperature steam environment. This would be the correct answer if the technician was packaging a heat-sensitive polymer camera cord for a vaporized hydrogen peroxide cycle. Option C. This is wrong for this scenario because woven muslin is highly absorbent and completely loses its barrier effectiveness when saturated with wet steam. This would be the correct answer if the question referenced an outdated historical textbook describing 1970s-era terminal sterilization packaging methods. Option D. This is wrong for this scenario because paper pouches require extended, 30-minute thermal drying phases to restore their protective barrier, making them fundamentally useless for an undried emergency cycle. This would be the correct answer if the technician was packaging a single stainless steel needle holder for a standard terminal steam cycle aimed at long-term shelf storage. Concept extension. Aseptic transport using an approved container is required because carrying a hot, wet, uncontained instrument through the hallway exposes the surgical tool directly to airborne dust and staph respiratory droplets. Question 60. While reviewing the latest infection control swab results from the clean assembly workstations, a technician identifies a specific strain of Staphylococcus aureus. In the context of medical microbiology, how must the technician scientifically classify this particular microscopic organism that actively initiates clinical infections within human hosts? A. As an opportunistic environmental fungus. B. As a highly transmissible pathogenic entity. C. As a non-living, misfolded prion protein. D. As a beneficial, symbiotic digestive bacterium. Correct answer, B. Knowledge point explanation. Core rationale. In microbiology, a pathogen is defined precisely as any biological agent, virus, bacterium, or other microorganism that possesses the inherent capacity to cause disease or illness in its host. Because Staphylococcus aureus triggers severe surgical site infections, it is officially classified as a pathogen. Trap analysis. Option A. This is wrong for this scenario because Staphylococcus is a true bacterium, not a spore-producing fungal organism. This would be the correct answer if the technician identified a colony of Aspergillus mold growing on a damp cardboard shipping box left in the receiving area. Option C. This is wrong for this scenario because bacteria are living, single-celled organisms, whereas prion are merely rogue, infectious protein molecules lacking DNA. This would be the correct answer if the technician was reviewing the neurological brain tissue hazards associated with transmissible spongiform encephalopathies like Creutzfeldt-Jakob disease. Option D. This is wrong for this scenario because a microbe causing a clinical infection is actively harming the host, making it the exact opposite of a helpful symbiote. This would be the correct answer if the technician was describing the normal gastrointestinal flora, like lactobacillus, that actively aids human digestion. Concept extension. Pathogens represent a tiny fraction of the total microbial world, yet they are the sole target of all mechanical, thermal, and chemical decontamination processes executed by the sterile processing department. Question 61. While meticulously inspecting a delicate neurosurgical tray in the clean assembly room, an SP technician actively applies the principles of asepsis to their physical workflow. In this specific clinical processing context, what state is the technician striving to maintain? A. The absolute elimination of all microbial life including highly resistant bacterial spores. B. The complete absence of disease-causing pathogenic microorganisms from the immediate environment. C. The proactive administration of prophylactic antibiotics to the surgical patient. D. The total suppression of all localized healthcare-associated transmission chains. Correct answer, B. Knowledge point explanation. Core rationale. Asepsis literally translates to the absence of disease-causing contaminants. The principles of asepsis are the active physical practices of maintaining strict situational awareness regarding the exact microbial status of an item and ensuring that tools handled in the clean area are kept entirely free from pathogens before they are packaged for the final sterilization phase. Trap analysis. Option A. This is wrong for this scenario because it defines the absolute state of sterility, which is achieved later inside the autoclave, not the baseline state of asepsis maintained during manual assembly. This would be the correct answer if the technician was asked to define the ultimate physical goal of running a 270-degree Fahrenheit steam cycle. Option C. This is wrong for this scenario because administering medication is a direct nursing or physician duty, not a physical processing task related to aseptic instrument handling. This would be the correct answer if the question asked how the clinical surgical team chemically prepares the patient's immune system prior to a major joint replacement. Option D. This is wrong for this scenario because stopping infection chains is the broad facility-wide goal, while asepsis is the specific condition of being free from pathogens at the immediate workstation. This would be the correct answer if the technician was defining the ultimate, overarching objective of the hospital's dedicated infection prevention department. Concept extension. Aseptic technique applies everywhere in the facility, dictating that a technician must never touch a disinfected tray after handling an unwashed transport cart without first performing rigorous hand hygiene. Question 62. An SP technician is preparing a heavy 25-pound orthopedic set for terminal steam sterilization. To instantly and visually differentiate this completely unprocessed tray from identical trays that have already completed the thermal cycle, where must the technician affix the Type 1 chemical indicator? A. Deeply embedded within the most challenging central core of the instrument basket. B. Firmly attached to the outermost exterior surface of the synthetic sterilization wrapper. C. Taped directly onto the physical metal handles of the largest surgical retractors. D. Placed exclusively alongside the biological indicator vial inside the testing incubator. Correct answer, B. Knowledge point explanation. Core rationale. External chemical indicators, such as indicator tape or pre-printed dots on pouches, are specifically designed to be placed on the outside of every package. Their sole purpose is to serve as a visible process indicator, allowing staff to instantly recognize that a package has been physically exposed to the sterilization cycle and is not unsterilized raw inventory. Trap analysis. Option A. This is wrong for this scenario because placing an indicator deep inside tests internal sterilant penetration, defeating the purpose of external visual cycle verification. This would be the correct answer if the technician was placing a Type 5 integrating indicator to ensure steam reached the most difficult to heat area of the tray. Option C. This is wrong for this scenario because tape adhesive leaves stubborn, damaging residue on surgical-grade stainless steel. This would be the correct answer if the question described an outdated and strictly prohibited method of identifying specific instruments that causes severe pitting corrosion. Option D. This is wrong for this scenario because external indicators must travel with the individual trays into the chamber, whereas biological vials are incubated separately to culture spores after the cycle. This would be the correct answer if the technician was placing a rapid readout fluorescent vial into a specialized heating block. Concept extension. A color change on an external indicator tape proves only that the tray passed through the heated chamber. It does not guarantee that the interior surgical instruments are actually sterile. Question 63. During a departmental in-service in the assembly area, the sterile processing manager holds up a flawlessly cleaned and perfectly functioning robotic instrument as an example of the department's ultimate objective. What specific industry term officially defines this high degree of excellence achieved in the final distributed product? A. Lean manufacturing optimization. B. Six Sigma error reduction. C. Product and service quality. D. International standardization compliance. Correct answer, C. Knowledge point explanation. Core rationale. In sterile processing, quality is literally defined as the degree or grade of excellence of a product or service. When a technician meticulously inspects a tool, tests its articulation, and seals it flawlessly, they are producing a high-quality product that ensures patient safety and surgical success in the operating room. Trap analysis. Option A. This is wrong for this scenario because lean refers to the procedural elimination of workflow waste, not the inherent physical excellence of the finished instrument itself. This would be the correct answer if the manager was praising a new workstation layout that reduced the technician's physical walking distance by 50%. Option B. This is wrong for this scenario because Six Sigma is a statistical methodology used to mathematically decrease defects, not the definition of the excellent product condition. This would be the correct answer if the manager implemented a rigid mathematical tracking system aiming to reduce packaging tears to less than 4 per million cycles. Option D. This is wrong for this scenario because following standards creates quality, but compliance is a regulatory status rather than the physical grade of excellence. This would be the correct answer if the facility had just passed an external audit conducted by an independent global certification organization. Concept extension. Quality control indicators, such as tracking the percentage of trays returned from the operating room with missing items, provide the measurable data needed to verify if the department is actually achieving this level of excellence. Question 64. The Sterile Processing Director is finalizing the annual departmental budget and requests a technician to log the serial numbers of 3 newly installed multi-chamber mechanical washer disinfectors. Within the facility's financial supply chain management system, how are these massive, expensive machines officially classified? A. As disposable single-use procedural supplies. B. As high-cost capital equipment assets. C. As loaned vendor tracking inventory. D. As low-cost consumable bulk items. Correct answer, B. Knowledge point explanation. Core rationale. In supply chain and hospital finance, capital equipment refers to significant, long-lasting physical assets that require a substantial financial investment, typically possessing a high purchase price. Heavy machinery like industrial washer disinfectors, automated endoscope reprocessors, and steam sterilizers fall strictly into this high-cost budgetary category. Trap analysis. Option A. This is wrong for this scenario because massive mechanical washers are permanently installed for a decade of continuous use, not thrown away after one cleaning cycle. This would be the correct answer if the technician was logging a newly delivered pallet of synthetic sterilization wrapper sheets. Option C. This is wrong for this scenario because the facility purchased and permanently owns these heavy machines. They are not temporarily borrowed surgical instruments. This would be the correct answer if the technician was scanning in an intricate titanium spinal fusion set delivered by an external sales representative for a single surgery. Option D. This is wrong for this scenario because industrial washers cost hundreds of thousands of dollars and are definitely not cheap, frequently reordered bulk items. This would be the correct answer if the technician was updating the par levels for the boxes of biological indicator vials kept on the testing shelf. Concept extension. Capital equipment purchases require a rigorous justification process, meaning the Sterile Processing Director must mathematically prove the new washers will drastically increase departmental throughput and reduce water consumption to secure the funding. Question 65. A technician is utilizing a handheld barcode scanner in the decontamination area to log the arrival of 6 sequential compression devices returning from the surgical wards. What is the primary logistical advantage of meticulously tracking the physical location and processing status of this mobile patient care equipment? A. It automatically dictates the precise financial charges billed to the individual patient's insurance account. B. It strictly mandates that a highly trained computer specialist operate the tracking software interface. C. It proactively ensures clinical availability and prevents critical supply shortages across the facility. D. It instantly validates the internal electronic circuitry of the device against manufacturer specifications. Correct answer, C. Knowledge point explanation. Core rationale. Mobile patient care equipment, such as compression pumps and infusion monitors, constantly circulates throughout the hospital. By actively tracking these devices, the Sterile Processing Department always knows exactly how many units are clean and ready, how many are in use, and how many are awaiting decontamination. effectively preventing equipment hoarding and clinical shortages. Trap analysis. Option A. This is wrong for this scenario because sterile processing logs track asset locations to facilitate equipment turnaround, not to generate patient financial billing invoices. This would be the correct answer if the question asked about the primary function of the hospital's central clinical coding and medical records department. Option B. This is wrong for this scenario because modern scanning systems are explicitly designed to be user-friendly for standard processing technicians on the floor, not restricted to software engineers. This would be the correct answer if the facility's main server crashed and required a dedicated information technology professional to rebuild the database architecture. Option D. This is wrong for this scenario because a barcode scan merely updates a logistical database. It does not physically test the electrical functionality of the machine. This would be the correct answer if a clinical engineering technician plugged the compression device into a diagnostic multimeter to verify its precise voltage output. Concept extension. If equipment tracking breaks down, clinical units may hide or hoard infusion pumps out of fear they will not be able to get one when needed, which artificially creates a massive shortage across the rest of the healthcare facility. Question 66. A technician in the decontamination area discovers a flexible endoscope with a snapped articulation cable that just caused a severe patient injury during a bronchoscopy. They must immediately quarantine the device and assist the manager in filing a mandatory adverse event report. Which federal agency enforces the legal requirement to report this specific medical device failure? A. The National Fire Protection Association. B. The Environmental Protection Agency. C. The World Health Organization. D. The Food and Drug Administration. Correct answer, D. Knowledge point explanation. Core rationale. The Food and Drug Administration regulates the safe manufacturing and reporting of all medical devices used in healthcare. When a device malfunctions and causes serious patient injury or death, the facility is legally mandated to report the incident to this specific agency through the medical device reporting system so a nationwide recall or investigation can be initiated. Trap analysis. Option A. This is wrong for this scenario because this agency regulates building safety codes and fire prevention strategies, not medical device malfunctions. This would be the correct answer if the technician was asked to identify the organization that dictates the required clearance distance between stored sterile supplies and the ceiling sprinkler heads. Option B. This is wrong for this scenario because this agency regulates environmental protection and the disposal of hazardous chemicals. This would be the correct answer if the technician was reviewing the legal disposal requirements for pouring expired liquid glutaraldehyde down the facility drain. Option C. This is wrong for this scenario because this is an international guidance organization that provides global health recommendations, not a United States federal regulatory body with legal enforcement powers over domestic device reporting. This would be the correct answer if the question asked to identify the group that originally established the internationally recognized hand hygiene protocols. Concept extension. The quarantined endoscope must never be cleaned or processed in any way, as doing so would destroy critical forensic evidence needed by the federal investigators and the manufacturer to determine the root cause of the mechanical failure. Question 67. While assembling a specialized orthopedic hand tray, a technician must select specific microelevators and delicate tissue scissors. The surgical schedule indicates these instruments will be used to physically alleviate compression on a patient's median nerve by excising surrounding wrist tissues. What is the correct medical terminology for this specific operative intervention? A. Carpal tunnel repair. B. Ulnar nerve transposition. C. Arthrotomy. D. Fasciotomy. Correct answer, A. Knowledge point explanation. Core rationale. The carpal tunnel is the narrow anatomical passageway in the human wrist housing the median nerve. When this nerve becomes compressed, typically from repetitive motion, the surgical procedure to cut away the constricting tissue and release the pressure is officially documented as a carpal tunnel repair or release. Trap analysis. Option B. This is wrong for this scenario because this procedure involves relocating a completely different nerve located near the elbow joint, not the median nerve in the wrist. This would be the correct answer if the technician was preparing an arm tray for a patient experiencing severe numbness radiating from the cubital tunnel. Option C. This is wrong for this scenario because this translates to the general surgical incision of any joint space, not the specific repair of a nerve pathway. This would be the correct answer if the question asked for the broad terminology defining an open surgical exploration of a patient's knee capsule. Option D. This is wrong for this scenario because this procedure involves slicing open the fibrous fascia surrounding a muscle to relieve severe swelling pressure. This would be the correct answer if the technician was rushing a major emergency tray to treat acute compartment syndrome in a patient's lower leg following a severe crush injury. Concept extension. Instruments utilized in delicate hand and wrist repairs are extremely fragile and must be heavily protected using approved foam sleeves or silicone mats during both the manual decontamination phase and the final packaging process. Question 68. An SP technician is operating a bulk steam sterilizer that utilizes a programmed sequence of pressurized steam injections and sudden exhaust vents to forcefully expel the cold air out of the chamber drain. Under which specific mechanical classification does this steam flush pressure pulse equipment fall? A. Gaseous modalities. B. Gravity displacement. C. Dynamic air removal. D. Conditioning phases. Correct answer, C. Knowledge point explanation. Core rationale. Steam flush pressure pulse sterilizers do not passively wait for steam to push air out. Instead, they actively and mechanically force the air from the chamber utilizing rapid pressure changes. Therefore, alongside traditional pre-vacuum sterilizers, they are classified as dynamic air removal systems. Trap analysis. Option A. This is wrong for this scenario because steam is the sterilant, and while it is technically a vapor, this category specifically refers to low-temperature chemical gases. This would be the correct answer if the technician was categorizing an ethylene oxide machine utilized for processing heat-sensitive polymers. Option B. This is wrong for this scenario because gravity sterilizers rely entirely on the passive physical principle that hot steam is lighter than cold air. This would be the correct answer if the technician was operating a basic tabletop autoclave that slowly fills with steam from the top down, pushing the cold air out the bottom drain without any mechanical assistance. Option D. This is wrong for this scenario because conditioning is merely the initial stage of a cycle where the load is heated, not the classification of the machine itself. This would be the correct answer if the question asked to identify the specific period during the cycle when the steam is first introduced to prepare the instruments for the exposure phase. Concept extension. Because dynamic air removal systems utilize such aggressive mechanical forces, they mandate the daily utilization of a Bowie-Dick test to continuously verify that the mechanical air expulsion components are functioning flawlessly. Question 69. A technician is unloading a multi-level instrument rack from an automated washer disinfector. They note the cycle printout confirms the final phase maintained a temperature of 180 degrees Fahrenheit for 1 minute to destroy vegetative pathogens on the metal surfaces. What specific physical element is entirely responsible for achieving this level of microbial kill in this automated process? A. Heated chemical agents. B. Warmed glutaraldehyde solutions. C. Extended high-pressure steam. D. Extreme thermal heat. Correct answer, D. Knowledge point explanation. Core rationale. Thermal disinfection relies strictly on the physical transfer of heat to destroy microorganisms. In an automated washer disinfector, this is accomplished by bathing the instruments in extremely hot water for a sustained duration. The heat energy itself denatures the pathogen's proteins, rendering the instruments safe for handling without the use of harsh chemical biocides. Trap analysis. Option A. This is wrong for this scenario because standard washer disinfectors utilize heated water, not specialized biocidal chemicals, during the thermal rinse phase. This would be the correct answer if the technician was utilizing an automated endoscope reprocessor that heated a high-level disinfectant solution to increase its microbial killing efficacy. Option B. This is wrong for this scenario because glutaraldehyde is a toxic liquid chemical sterilant manually utilized in well-ventilated soaking basins, never inside a standard mechanical washer. This would be the correct answer if the question asked what specific liquid agent a technician must wear heavy nitrile elastomer gloves to safely handle during manual high-level disinfection. Option C. This is wrong for this scenario because steam is a sterilization method designed to kill highly resistant spores, whereas the washer only achieves disinfection. This would be the correct answer if the technician was placing the instrument rack directly into an autoclave chamber programmed for a 270 Fahrenheit terminal cycle. Concept extension. The thermal disinfection phase is the final critical step in the mechanical cleaning process. If the machine's heating element fails and the water does not reach 180 Fahrenheit, the entire load must be considered contaminated and re-washed. Question 70. Working at the clean assembly station, a technician is inserting a single lightweight hemostat into a standard paper plastic packaging material. To ensure the package maintains a verified, unbroken microbial barrier during long-term storage, which specific closure mechanism must the technician utilize? A. Standard metal office staples. B. Commercial adhesive painter's tape. C. Integrated self-sealing adhesive strips. D. Tension-based metal paper clips. Correct answer, C. Knowledge point explanation. Core rationale. Sterile peel pouches must be completely sealed to prevent any air or moisture channels from allowing bacterial ingress. The only two manufacturer-validated methods for sealing these pouches are utilizing a calibrated thermal heat sealer or peeling the protective backing off the pouch's built-in integrated self-sealing adhesive strip and folding it precisely along the perforated line. Trap analysis. Option A. This is wrong for this scenario because staples physically puncture the paper and plastic layers, creating permanent holes that instantly destroy the sterile barrier. This would be the correct answer if the question asked to identify a strictly prohibited fastening method that will guarantee an immediate regulatory failure during an inspection. Option B. This is wrong for this scenario because painter's tape is not designed to withstand sterilization temperatures or moisture, and its weak adhesive will melt or peel off. This would be the correct answer if a facility maintenance worker was temporarily securing a protective plastic sheet over a doorway while painting the adjacent hallway. Option D. This is wrong for this scenario because metal clips do not create an airtight seal and their sharp edges can easily snag and tear the delicate paper backing during transit. This would be the correct answer if the technician was organizing a stack of administrative human resources paperwork on their office desk. Concept extension. When utilizing the self-sealing flap, the technician must ensure absolutely no wrinkles, creases, or air channels are formed in the adhesive seal, as any defect provides a direct microscopic highway for pathogens to enter the pouch.